I'm Dr. Amos, and as many of us know, the month of October is the Breast Cancer Awareness Month, and that's the reason why I'm wearing pink today. So, with breast cancer being the second most common cause of cancer death, I'll be talking to us today about a very important topic, which is the self-breast examination. Is very, very important because it helps with early detection, early diagnosis, early treatment. So before we go into that, many of us would like to know, many of us ask this question: so what's the cause of breast cancer? What's the cause of breast cancer? What is breast cancer? So the body, the entire body is made up of so many cells. So the cells in the breast, when they grow out of control, they start to grow out of control, they start to proliferate out of control. This is what breast cancer is. And the cause of breast cancer is not specifically identified yet. But there are certain things we call risk factors. These are like risk factors are things that can predispose you to having breast cancers. And these predispositions, the things that predispose you to having them, they're things that we have control over and things we don't have control over. We're either born with them or we just had them. So that's what we call the modifiable and the non-modifiable risk factors. So for these, we'll start with the things that we have no control over. That's the non-modifiable risk factors, which includes the age. So the higher the age, like the elderly, they are more predisposed to having breast cancer. Younger age, less predisposed to having breast cancer. Doesn't dispute the fact that they can have breast cancer, but they are less predisposed to having breast cancer. Things like our race, the blacks are more predisposed to having breast cancer. Things like positive family history of breast cancer in first generations, like example like mother, sister, aunts. If you have positive family history of breast cancer in either of the things, other people I mentioned above, you're more predisposed to having breast cancer. Things like nulliparity. If you've never had children before, you're more predisposed to having breast cancer because you've never had children, you've never had to breastfeed. So breastfeeding actually reduces our risk to having breast cancer. So other things like early age at your first period, that's early menarche. So early age at your first period, if you started your period at a very early age, you are more predisposed to having breast cancer. Late menopause, rather. If you went into menopause at a very late age, so you are more predisposed to having breast cancer. So those are the things that we have no control over. So now moving on to things that we can control, which is majorly our lifestyle, such as smoking. If you smoke, you're predisposed to having breast cancer or any cancer at all. Smoking, alcohol consumption, drugs like oral contraceptive pills, hormone replacement therapies, sedentary lifestyle, obesity. When you're obese, you're more predisposed to having breast cancer. Eating fatty diets, which can make you obese, makes you more predisposed to having breast cancer. So with that said, I'll be talking to us about the age, because many of us ask this question: so at what age should we start self-breast examination? So I would like to say that ideally the age is 20 and above. So but if you have any of these risk factors that I mentioned above, like if you have a positive family history majorly of breast cancer, I think you should start at an early age, maybe 16, 18. You should start self-breast examination earlier. So with that, I'll talk to us about the procedure for a self-breast examination. So to do this, you need a mirror. You can do self-breast examination by standing and by lying down. But before then, you need a mirror for the visualization aspect of the self-breast examination. So you take off your shirt, stand in front of a mirror, and then you're looking. And it's good that you do this self-breast examination every day. I'd advise, because if you do it every day, if there are any abnormalities, you can easily detect it. Because you see your breast, you do the examination every day, you know what your breast is like every day, you know what it feels like every day. So if there are any abnormalities, you identify it faster because you know what it is already. So you stand in front of your mirror. Back to the procedure. Stand in front of your mirror, your hands down, your your shirt is off, your bra is off, so you're just looking at your breast. And then what are you looking at? What are the things that we should look out for? You're looking at the shape of the breast. Is there any abnormality in the shape of the breast? Any dimpling? Any abnormal discoloration? Any rash? Any swelling? Is the nipple inverted or everted? Everted nipples are, it's like when your nipple is normal, it's everted. Well, if you have an inverted nipple, then we have a problem. So those are the things you should be looking out for. Are there more than one breast? Is the position of the breast normal? So when you're done looking, you also put your hands on your waist as well and visualize. Look at it at the mirror. So after looking, the next step is to touch, to palpate the breast. So you can put your hand behind, because it's helping to expose your armpit area as well as your breast. And this palpation, you can do it, you're going to do it standing and lying down. But I'm starting with standing first because we already visualized standing. So you're standing, you put your hand behind your head, exposes your armpit and the breast, because many of us ignore, we do self breast examination every day, and then we ignore the fact that you can actually have a lump under your armpit because there are lymphatics at the armpit, lymphatic drainage at the armpit. So you can actually have a breast lump under your armpit all the way. So we have to palpate and examine that part as well. So your hand behind your head, and then you visualize dividing your breast into 4 quadrants, into 4 parts, like this and like this, so as to help us go all around the breast. So palpating, you start with light palpation at the 4, going around the 4 quadrants. Make sure you touch, light palpation all through the 4 quadrants of the breast. Done that, we're going deeper, like deep palpation all through the 4 quadrants of the breast as well. Make sure to palpate the armpit, check for lumps and everything. And then lastly, you're going to pinch the nipple for any discharge. If there are any discharge, you're going to look at the color. Is it milky? Is it whitish? Is it bloody? You look out for that as well. And after that, you should do the same thing. Lie down supine with your hands above your head as well, and go through the same quadrants with the same way I mentioned when we were standing. So you do the same thing, and it's very important that we do this every day because it helps. It really helps. It helps with early identification. If you notice any of the abnormalities I mentioned above, even by looking and by palpating, if you notice anything, any abnormalities, go to your doctor. Doesn't matter how small. If you notice any rash or any abnormal discoloration in your breast, go to your doctor. Don't just ignore it and just say, oh, it's just a rash, or it's just redness, or it's just a milky discharge, it's just watery discharge from my breast. Go to your doctor. It's very important. It helps with early detection, early diagnosis, and treatment. It really helps because many people ignore things like a swelling or a lump in their breast, and then it progresses, it then becomes worse, and then turns to something else that is beyond your control. That's when you then come to your doctor, and maybe it's too late for us for certain interventions. So it's really important that we do the self breast examination every day. We're doing it every day, like I said earlier. It helps you identify any abnormalities early enough, because it's a constant thing. So I advise our sisters, our aunts, our daughters, if you do it every day, your daughters definitely learn to do it every day. I advise them to do it. It's very, very important. It helps prevent, and it helps prevention, basically. It's a preventive method, because once you've identified any abnormalities, and I'll also like to point out that it's not every lump that is breast cancer, and that's why we are advising you do this self-breast examination. And if you notice any lump, go to your doctors. There's some lumps that are benign, they are not cancerous. So once they are noticed, faster interventions can be done. So if you notice any lump, any abnormalities like I mentioned earlier, contact your doctor. So with that said, I'd like to thank you all for listening and have a nice day. Bye.